Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Today I'm going to show you a short routine that you can use to help strengthen your knees. This is something that you can do once or twice a week. If you've had surgery and you're unsure of whether this routine may be safe, you should check with your surgeon before performing these exercises. Otherwise, let's get right to it. So basically for this routine, I just want you to follow along and do the exercise that I'm going to do. We're going to have 4 different exercises, and to start, we're just going to do a simple warm-up. Nothing heavy because this is not meant to be a full workout, but rather a simple, short routine to help you strengthen your knees. So for the warm-up, we're going to start with some knee circles. We'll put our feet together, have a slight bend in the knees, hands above the kneecaps, and rotate in one direction. These don't really need to be big circles. And then in the other direction. And then back in the first direction, 4 or 5 circles, and then in the other. And basically, we're just trying to get synovial fluid to all the parts of the joint surface. Excellent. And then, again, this is meant to be the warm-up. We're just going to start with some easy squats, and what we like to do is to get the full range of motion so that all of the joint surfaces see synovial fluid. So for this, with our feet just about shoulder width apart, you can have them angled, your feet angled directly to the front or slightly out 5 to 10 degrees, and we're just basically going to sink down to the bottom, right to the bottom, and then back up to the top. Now when we do these, we want to make sure that we keep our knee out over the middle aspect of our foot, and we want to try to drive our knees into that position, opening up the pelvis or opening up the hips. And back up. And when we come back up, we want to push with the middle to the hind part of the foot as opposed to the front of the foot. So we don't want to pull ourselves up over our foot, we want to drive ourselves up through the middle of the foot. So down, and when we're down at the bottom, rock one side to the other, back up, down, back up, down, back up, one more, and back up. We're going to go back to the start again, feet together, bend the knees, five in one direction, and again, 5 in one direction, and then 5 in the other. And at this point, you should start to be getting a little bit of warmth in your thighs and around your knees, and then back into a squat position, feet slightly turned out, down. And let's just do 6 reps here. Excellent work. So that's the warm-up. Now let's get to the actual routine. So for the first exercise, we're not actually going to be counting reps, but rather time. And this first exercise, we've already done it partly in the warm-up. So for this one, we're going to be doing a squat hold. And this is a hold at the bottom of the squat position. So again, if we start shoulder width apart, we're going to sink down to the bottom, right to the bottom, and we're going to hold. And in this position, we're really trying to make sure that we don't allow the knees to collapse, but rather drive the knees out over the outside edge of the feet. And we're really working to activate our glutes here on the side, at the back, and we're really working to close down the inside of the joint with our VMO. So this squat hold position, which we're going to try to hold for time, is going to work to activate our glutes and to activate our VMO. So this is really good. The other thing that we're going to try to do while we're in this position is we're going to try not to allow our feet to collapse in, but rather to maintain our arch. So we want to grip the floor with our feet. So we're really working the arch, working our glutes, and working the VMO. And we try to hold this for 30 to 60 seconds. So I've been talking probably for about 30 seconds there, so we'll hold this for another 30 seconds or so. And what we'd like to do is generally, over time, build up the amount of time that we can spend in the squat hold position. And you can do a number of different things with your arms here, so you can hold them in front, you can relax them here, you can alternate reaching here, you can do other things, reach towards the sky, but basically we're trying to hold in this bottom position. So that's about 60 seconds there. Drive the knees out when we come up, squeeze the cheeks, and that's the squat hold. So again, we're working to hold this for at least 30 to 60 seconds, but as we get stronger, we'll hold it for longer and longer. If you can't do a full squat hold or a full range of motion squat hold, then there are a number of options. One of them is to do a squat hold in a quarter squat position. And for that, all we're going to do is come down quarter of the way and hold. Or if you are a little bit stronger but still can't get to the bottom, then you can go to the half squat position and you can hold it here. If you can't even do that, then another option is for you to do a squat or a part squat hold against the wall. And so you can do a quarter squat hold against the wall, a half squat hold against the wall. Each of these positions is fine, and you should pick the position that works with your level of strength and your level of comfort. So that's the squat hold. The next exercise that we're going to do is a glute bridge. So for the glute bridge, what we're going to do is we're going to start with our feet together, and you want to have approximately 1 foot away from your buttock. And what you'd like to do, you can put your hands here on the ground, or you can put your hands across the chest. Basically, you're going to squeeze your glutes, and drive your pelvis towards the ceiling. As I said, hands here on the floor, or just elbows by your side. And again, this is not for a count, but this is for time. Of course, you could do a hold, but if you have a higher level of strength, then you can start to do glute repetitions. The hold is easier because this is what we call an isometric position, which doesn't change. But you can increase the difficulty level by doing repetitions. And if you want to increase the difficulty level even further, then you can go to one leg and increase the length of the lever. So that's the glute hold, or glute bridge hold. So the glute bridge is an excellent exercise which helps to strengthen the gluteal muscle to allow you to better position your leg when in dynamic movement, or in other words, when you're changing direction. The additional benefit of doing the glute bridge is that you can strengthen your glutes and your hamstrings to help balance the effect of your quadricep muscles on your knee. Because obviously you want the muscles on both the front and the back of the leg to be balanced. So the next exercise that we're going to do is the natural knee extension. This is also called the natural leg extension. And this is a closed chain variation of the knee extension exercise, which helps to strengthen the quadricep. We just did an exercise to help strengthen the glutes and the hamstring. So now we're going to work on the front. So for this exercise, you're going to get into a kneeling position. And we want to make sure that when we perform this exercise that our hips are extended and our glutes are activated. So that means to pinch your cheeks together, squeeze your glutes, and tilt your pelvis towards the front. And basically for this, we are just going to come back and then push ourselves back to the starting position. So this is the starting position, come back, as far as you can, and then back up. Obviously, the stronger you are, the further back you can go before you come back to the resting position. If you find this too difficult to do as a dynamic movement, then you can do this as a hold. And again, just as with our other holds, you want to hold this for between 30 to 60 seconds. And you want to make sure that during that whole time, your glutes are activated and that your pelvis is tilted toward the front. And then you, at the end of your hold, you come back to the resting position. So once again, the hold itself is the easiest variation. The dynamic movement is the next level of progression. And to make it more challenging, you're going to increase the distance or the range of motion through which you make this kneeling or this extension movement. And obviously, if you are very, very strong, then you'll be able to get all the way to the floor and touch your head or shoulders to the floor, but that's something that you work up to over time. So for this exercise, again, we would do 5 or 6 repetitions, or if you're doing a hold it for 30 to 60 seconds. The last exercise that we're going to do is going to help us to isolate one leg at a time to help work on strengthening. And this gives us the opportunity to really focus on knee position and therefore the recruitment of the VMO or the inside part of the quadricep. So we're going to do lunges here. And you can do these as step forward lunges or as step back lunges. It doesn't really matter. You can do here, I'm going to demonstrate as a step forward lunge. Just as with the squat, we want to make sure that when we place our foot, the knee is over the outside edge of the foot. We're just going to basically take one step in front, drop down to the ground in a controlled manner, and bring our back knee to the ground. And it's going to look something like this. And back to the starting position. So we're going to do 5 repetitions on one side, and notice that that knee drives out over the outside edge of the foot. So that's 5 in one direction. Then we're going to change to the opposite side. And that's 5 per side. So now we've done all of our 4 exercises, and I've coached you. Now we're just going to go through and either, as I said, we're going to hold for 30 to 60 seconds, or we're going to do 5 to 6 repetitions. All right, so for the first one, squat hold. So let's get these feet shoulder width apart, drive the knees out, down to the bottom. Timer starts now. Again, as I said, there's any number of things that you can do with your hands while you're in this position, and we want to try not to allow the feet to collapse down. So we're just keeping active when we're in this position. Rocking back and forth. You can think about what you got to do today, whatever, to take your mind off of this position. You want to try not to hunch down, but try to keep the back active and nice and tall. I think that's about 30 seconds, so we got another 30 seconds to go. I think we've got 10. 5, 4, 3, 2, 1. Excellent work. The next exercise that we're going to do is going to be the glute bridge. We'll go to that right away. Remember, you can do individual repetitions, or you can do the squat hold. Hands across the chest, hands on the floor. You pick your level of poison. Let's go. If you really want to be challenging, you can do repetitions and then hold for 30 seconds on the last one. Nice work. Right into the natural knee extension. Knees shoulder width apart. Tilt the pelvis, squeeze the glutes, and repetitions. And for that extra challenge, that's 30 seconds. And then our last exercise, 5 lunges per side. You can choose to do all of them on one side first, or you can alternate sides if you want. Excellent work. Shake it out. So there you have it, a simple routine that you can do, 4 exercises, a quick warm-up to help strengthen your knees. As I said, you can do this once to twice per week. Try it, let me know how you feel.